It's really important to talk about death and dying. It's a subject that we really avoid, and we struggle to know how to start these conversations. But for patients, family members, actually having those conversations, exploring it, either with your family members or actually with a professional, does mean that we can help plan and know what your wishes are. Sometimes we don't know how to start the conversation, but I find it's about beginning with perhaps looking at what the person's understanding is of what's going on for them. And that often leads to concerns about the future and having the discussion about what their wishes are. So sometimes it's about just finding the right opportunity, and sometimes saying, there's something I really want to discuss that's important, and I'm wondering if that's okay to have that conversation. Can we look at a time so we can sit together and look at that? And that invites the person into having a discussion. We don't have to do it all in one go, but actually often I find once we start that people really welcome the opportunity to talk about the worries, to put things in place. For myself, I had a patient that actually I discussed, and we raised the issues around planning for the future, about death and dying. She really wanted to have the conversations, but the family members, she didn't want to upset. Yet opening up that conversation with her family, she found so beneficial, as did the family members. She was able to talk about what her wishes were. And she actually came back and said the family had thought she'd wanted completely different. So it helped her to have peace of mind that she'd talked about it, had put plans in place, and it really helped the family because they wanted to do what mattered to her.